It's my pleasure to introduce the next speaker, the one and only Andrea Maier, who is also a member of the steering committee of the consortium. Thank you, Andrea, for being here.
Thank you so much. And thank you, Chiara, for this excellent talk, because it was a great introduction towards precision medicine, which we, geromedicine, by the way, which we want to do. I got the title matchmaking, and what I mean with this is really how do we go from gerodiagnostics, all the biomarkers of aging, into the gerotherapeutic ones, and how do we actually bring precision to what we do already in clinical practice. And yesterday, I told you that we now have a scope of practice for healthy longevity medicine. And I got many questions. So I reshuffled my talk a little bit, not talking about matchmaking so much, but talking about where the field is, because I think the entire audience needs to know where the clinical field is hunting towards to. These are my conclusions for today's talk of now 9 minutes left. So first of all, we have geroscience. I think most of us are here in the room knowing what geroscience is. That has to go into gerodiagnostics, which is the biomarkers of aging. I think that we have to shift it a little bit from the biological biomarkers of aging, much, much more to the clinical biomarkers of aging, and not forgetting the digital biomarkers of aging. So that's the shift. And hopefully we will have parallel sessions, maybe next year, where we can tackle all the biomarkers of aging. And then the gerotherapeutics, which could, of course, be clinically relevant and be cost efficient in the end. And these have to be matchmaked with the gerodiagnostics in the end. And that will lead into precision geromedicine. For the ones who do not know what geromedicine is, gero is aging and medicine is medicine. So it's really, yes, it's very easy. It's really the second version of healthy longevity medicine, because we get lots of arguments, healthy longevity medicine, I don't know what it is, not sexy, it's not Latin. So we said, okay, it's geromedicine, it's precision. Okay, so for the ones, a very general summary. So geroscience goes to healthy longevity medicine, which will be coined towards precision geromedicine. That goes into clinical practice, and that, in my view, has to go into the public health sector. So that's what we want to achieve in the next year or 5 years, or maybe more realistically 10 years. How does it look like in Singapore? I'm very fortunate to live in Singapore and to work there, to really build a nation where precision geromedicine is implemented. So we are also working with lots of preclinical teams on geroscience. We're bringing it from animal models into human models. We're bringing it into a research setup of gerodiagnostic and gerotherapeutics, where we look at all biomarkers of aging. We are matchmaking that with therapeutics, with lots of randomized controlled trials we are doing. We opened the first healthy longevity medicine clinic in a publicly funded hospital last year. We are doing lots of research there. And in parallel, we are training healthcare professionals to this new endeavor of medicine. So education is very important. And then whatever is validated and valid enough, we are bringing into the public health sector. And Singapore had a shift in the last year implementing Healthcare SG. And it was established in 2023, where actually the healthcare professionals, GPs, are responsible for the health of the nation. So whatever comes out of the research clinic, we are pushing up to the GP level, and we are going to now educate the GPs in Singapore from next year onwards. And that hopefully will give a shift towards a healthier nation in the end, and optimizing health and health span. And the academy we founded last year, the NUS Academy for Health and Longevity, is actually focusing on that translation into the public health system. Is anybody waiting on doing this? So that was the question we got 3 years ago. And we asked individuals, laymen on the street, really in a very unbiased way, do they know what health span is? Do they know what lifespan is? And would they like to come to a health and longevity clinic? And here you see the results. So it was a really unbiased approach. nearly 90% of Singaporeans know what lifespan is, half of them nearly know what health span is, and 2/3 of the population would like to come to a health longevity medicine clinic. We have a huge problem because we cannot afford this at this moment in time because we only have one clinic. We have 6 million people. If 4 million would come, help, not possible. That led to a consortium, the HELO Consortium. We are now doing the service worldwide. If you would like to participate, just let us know. At this moment in time, real time, we are surveying many countries to really know what the public really wants from us, from our field. Do they want biomarkers of aging? As one of the questions in our consortium survey. 2 years ago, we founded the Health and Longevity Medicine Society, really bringing healthcare professionals together to build the framework and the network. All healthcare professionals, please, here in the room, yes, this is not confidential. Use your iPhone or whatever phone you have. The QR code will lead you to our website to become a member. And we defined health and longevity medicine as optimizing health and health span by targeting aging processes across the lifespan. So we now have the paper where we describe what it is, will be published soon. And that actually gave us the opportunity to also build the first working group within HLMS. And the first working group was bringing healthcare professionals together who wanted to establish in publicly funded hospitals clinics. So we established a paper describing how to do that. It's published this year. Please have a look, where we really describe the diagnostic we think is valid enough to implement into clinical practice. We defined the outcomes, we defined the interventions, and especially who should do it, who should be in charge as a multidisciplinary team. And that, all of that, together with the brilliant work of the Biomarkers of Aging Consortium, together having the first randomized controlled trials, some being positive, some negative in humans, together with actually a definition what it is, that all led, and that's what I announced yesterday, to the first scope being signed off by a Department of Health, and that department is in Abu Dhabi. So this is a huge milestone. So from next year onwards, there will be, the Department of Health will go to health and longevity clinics to survey and to knock on their doors to see if they align with the standards we created. And I think that's a huge milestone, because then we can not only certify, but we can actually define what we do, and especially in my view, what we do not do. And this is where we possibly do not have evidence enough. So it's building a story with phenotypic characterization and with interventions. And very importantly, we have to do that longitudinally. We already implemented everything in clinical practice. We need you as clinicians to actually help us to make stories out of it. Because at the moment we have many data and we don't have a consistent story which is reproducible in the different clinics. And that's what we try to do. Very importantly, that we very often also here in the Biomarkers of Aging Consortium, we are forgetting the genome. That's the reason why Guido Krömer and other colleagues of mine, we met and we say, how does the genome actually fit? Then being translated in the epigenome, translated into proteomics, metabolomics, blah, 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 in the omics approach. So here in figure number A, you see the determined genes, which are very important. But I think this list is just small at the moment, and we just have to enlarge this and really have to embrace gerogenes and gerosuppressions, because many of the populations already have genome scans. We also have to embrace that we are not a snapshot. Whatever you do, we have to actually translate it into longitudinal data. And we did that with data from the UK Biobank, where we actually looked at organ-specific clocks, and we looked at the story of different organ systems, and we looked at decline of certain organs and what was the response of the next organ. So we actually made time dependencies of organ decline. So please have a look at that paper. It's very important that we really bring it into structure and frameworks. And one of the structures are ICD codes. So now we are working to operationalizing the vitality capacity or intrinsic capacity. And Cardiff University brought up 50 PIs together to actually see how can we define it and how can we make more organ-specific ICD codes related to aging. And that's what we are doing at this moment in time. Very importantly is building standards. So whoever here in the room, if you want to help building the standards, for example, with clinical or digital biomarkers of aging, think about skin health, think about oral health, think about women's health, men's health. Let us know, because we are forming these kind of collaborations. Then from a research perspective, we are doing lots of randomized controlled trials. Let's jump into cold water together and let's include different kind of individuals based on biomarkers of aging. We are doing that at the moment. Our first stratification is based on epigenetic clocks and to see if we can actually alter epigenetic ages of individuals. Another point we really want to do, and then I'm finishing, is how do we define optimal levels? For me, as a health and longevity medicine physician, normal is not good enough. We are dichotomizing health into abnormal and normal. How can we reach more categorization of what is optimal or even suboptimal? And that's what we're doing. So please reach out if you have, if this is also what you want to do. There's a crowd here from NUS. Please visit their posters. There is still time in the next round. So you see the posters here, and thank you so much for your attention. If your memory is good, you saw already this slide. So this is the roadmap towards precision medicine, and come to Singapore in February. Thank you.